Hello, I'm Mary Ito, and welcome to CRAM. Thanks for joining me as we explore new and innovative research and big ideas that may change the way you think and act. Many researchers have called the pandemic the world's greatest experiment. But what about the world's greatest love experiment? It's been a test for millions of couples who faced lockdowns, risks around COVID, setbacks of financial loss, and other challenges. One researcher who's wondered about the effects of COVID on couples is Amy Muise. She was involved in a large international study called Love in the Time of COVID. But she's also been fascinated with what keeps relationships alive and thriving throughout the years, pandemic or not. Amy Muise is an associate professor in the Department of Psychology at York University in Toronto. Hi, Amy. Nice to see you again.
Hi, Mary. It's a pleasure to be here.
That's a catchy title, Love in the Time of COVID. Tell us what that project is all about.
Yeah, so that's a large-scale international project that's actually led by a former postdoc of mine, Rhonda Balzerini, and some other colleagues, Rich Slatcher and Julia Zopalat. So I really have to give them the credit for collecting all this sort of wonderful data. And what they did is they got everything together right after the pandemic hit and started surveying people. It started in North America, but it spread all over the world. Started surveying people about what they were experiencing during COVID. And because all of us are primarily relationship researchers, those were a lot of the questions that they included, asking people about their relationships and, some of the changes that might be happening in that area of their lives.
What was the excitement for researchers about capturing this kind of information during the pandemic?
Yeah, it's a good question. I mean, it's interesting because a lot of our research sort of got put on hold and changed, just like, so many things in our lives, right? This really shifted what we were able to do. We weren't going into our labs anymore. I think at the beginning, we were all sort of wondering, what are we going to do? And then, it seemed like this was this really unique opportunity to understand what people were dealing with. And I think quickly, many relationship researchers started wondering and wanting to study what was happening in terms of couples' lives during the pandemic. I mean, I guess the other reason is that one of the things that we're interested in relationship science is how external stressors and things outside the relationship can impact how couples feel, right? Like, is there this spillover effect from what's going on in your life to how you feel about your relationship and how you interact with your partner? And often we think about things like, having stress at work or other types of things. And this was this really unique external stressor that we could try to understand if and how this was spilling over to relationships.
Right. And you published a paper that was part of this larger study, which specifically looked at the romantic relationships during COVID. What did you find? Tell us about that.
Yeah, so this was one of the first things that we wanted to understand. And this was led again by Rhonda Balzerini, who's really spearheaded this project. And what we found was that when people reported more external stressors related to COVID, so the things that we asked people about were, financial strain. To what extent had they been experiencing more financial strain since the onset of the pandemic? How isolated, how lonely and isolated were they feeling in general? And then just general levels of stress since the onset of the pandemic. And what we found, which was what we sort of expected, was that couples who reported more of these external stresses related to the pandemic, they did feel less satisfied in their romantic relationships, and they were having more conflict with their partners. But the interesting and kind of positive part of all of this is when people perceived their partners as more responsive to their needs. So when they felt like their partners valued them, understood them, appreciated them, they were buffered from this negative impact of the stressors. So what that meant was when they saw their partner as very responsive, no longer were those external stressors having the same kind of negative impact on their relationship. So I think this is interesting for a few reasons. One is that it definitely suggests that external stressors are spilling over, and COVID-19 enhanced many different types of external stressors for people. but also that there's relationship processes. There's things that we can do in our relationships that can sort of buffer against how negative or whether those things are really going to have a negative impact.
So did you figure out the extent of that buffering? I mean, I'm wondering whether it buffered to the point where some people felt it had no effect, like no effect on their relationship.
Yes, we did find. So it did range. In some cases, it did completely buffer. And that was more for the things like stress and isolation. Often, perceiving a partner as more responsive could buffer that against feeling lower relationship satisfaction, in some cases, more conflict. Where we saw somewhat weaker or less consistent results was with the financial strain. So I think what might be happening there is because there's some very tangible things that can come about when you have financial stressors. Having a responsive partner could buffer that to some extent, but not always to the same extent as some of the other stressors that might be things that you could cope with more emotionally, right? Just because you can sort of emotionally manage your stress, it doesn't mean that you're necessarily going to be able to take care of all of your financial problems. So there's certainly limits to this, but it definitely gives us some insight into what types of things, relationship processes or interactions might be best at buffering, as well as things that might require other kinds of interventions, right? Or other kinds of support, which I think, at least in this study, the financial strain stood out as something that, maybe was still seeping into the relationship, even among very responsive partners.
And when you say that these people felt that buffering when they felt their partner validated them, they understood them, they were sympathetic to them, do we know exactly what that looked like, what was said? Because it would be interesting to know, the exact, how did they phrase it? What did they say? What made a difference?
It's such a good question. And I do think that part of it, I think, is really tailoring things to a partner. So it ends up being a bit idiosyncratic. There might not be, one universal way to be responsive to a partner. But I think part of this, of perceiving a partner as very responsive, is that they really get you, right? They really understand the specific ways that you might react to something or deal with something. And they try to provide you with the support that would best meet your needs. So in one way, you could think about it as like being, tailoring your support to your partner. A key part of perceived partner responsiveness is really feeling like known and understood by your partner. So it sort of goes beyond just like a positive feeling of, your partner loves you or, cares about you. There's also this element that like they really know and they really get you. And I think that part of that is being able to provide support that really matches maybe what the partner needs. And we know from other work that, actual responsive acts matter and tend to be perceived as responsive, but it's really those perceptions that tend to be driving things. So, a partner could think that they're, being very responsive, but if the other person doesn't sort of see it that way, then it's unlikely to have the same impact.
Right. And now this was an international study. I'm just wondering about, the demographics involved, about age range, and also would these results be true cross-culturally?
Yeah, that's an excellent question. The study was designed to be very inclusive across as many countries as possible. It wasn't as well designed to really compare different cultures, but we did a few things to try to get at this. So, one was we asked people to report on the social distancing or other COVID related policies that were in place in their area. So, we were thinking that related to these findings, one important thing just might be, what are the restrictions happening in the area? Could that be driving some of the external stressors? Could that play a role? And we didn't see, at least in what we were able to look at, we did not see that made a difference. So these aren't necessarily cultural differences, but these are things that are happening sort of outside of the person's control. We also were able to kind of crudely get at how I guess how many resources the country had by comparing GDP of the countries in which the people participating were living. And we didn't see that that made a difference either for any of our findings. So it would also be interesting to further investigate other ideas of culture, to see if that has an influence, because it's very possible that, responsiveness is expected and valued differently cross culturally. So it would
Mm,
be interesting to see how that played out. We couldn't perfectly get at that here, though.
yeah. And my understanding is there is quite a bit of evidence at the benefits or of the benefits of a healthy relationship. And I'm wondering if you could tell us, what would be some of the maybe surprising benefits that people don't realize that exist if you have a really good, healthy relationship with someone?
Yeah, there's work that suggests that having a satisfying romantic relationship is a stronger predictor of our overall health and well being than things like smoking, excessive alcohol use, physical activity. So, a lot of these things that we think about as health behaviors, actually having satisfying social relationships in general is a strong predictor of overall health and well-being. And then romantic relationships tend to be the most important among the social relationships for predicting those important outcomes. There's also one of the findings that I like to discuss when I talk about sort of this link between relationships and well-being and even sexuality, right? So that's one of the indicators in my lab is we look at sexual satisfaction and sexual frequency. And there's findings with older adults that when couples over the age of 70 engage in regular, satisfying sexual interactions, they're less likely to die in the ensuing 5 years. And this is after accounting for health and all of
Wow.
these other covariates that would be related to mortality. So I like that finding because it just sort of hits home like, and I don't even know that it's necessarily about the sexual part, right? It's just like having this regular, important, satisfying connection with a partner can really have these broad outcomes for our health and then even our mortality.
Is that really well known? Because I mean, how often do we hear about, well, how do we stay healthy and live longer? How do we, and here it is. I mean, that's really interesting.
Yeah. Yeah, I mean, there's lots of researchers that have been looking at, well-being researchers, and when you sort of look across the life domains, it's consistently comes out that the close relationship aspects are really important for overall health and well-being.
I mean, since you bring up sexuality, which really is, I guess, your mainstay, you've done a lot of work on that in relationships. Do we know how important sex is today, let's say, compared to, I don't know, 20, 30, 40, 50 years ago?
Yeah, that's a good question. There's been some findings. Jean Twenge has found that when she looks at a broader sample in the United States, people are actually having less frequent sex now. I think the most recent data she had was like 2012 compared to like a decade or more before that. So the frequency was declining slightly. I mean, I think it's still an expectation that people place on their relationships, especially in Western culture in North America. We tend to expect a lot out of our relationships. We want a partnership. We want someone who's going to support us in terms of our own goals and dreams and, support our personal growth. And then I think we also expect to have that strong, passionate, desirous connection with a partner as well. So I still think that we still find that people expect their romantic relationships to have that. And then we also find that those aspects of sexuality also tend to be predictive of how satisfied people are with their overall relationships.
Yeah, I mean, I don't know. I guess to me, it doesn't seem surprising that maybe frequency has gone down. Everybody just seems so busy, busy, busy.
Yeah.
And tired, tired, tired at the end
Yeah,
of the day.
that's right.
What about frequency of sex? I mean, what have you found there as far as, its importance? And I don't know if you can actually bring it down to a statistic, but maybe there is a statistic that says, generally speaking, this is the amount of times, a week a couple should have sex in order to have a good relationship.
Yeah, we've actually studied that very question. And some of this came about, because, when I was out living my life, but, pre-pandemic, when you'd be in social situations and at parties, this was once people found out the kind of work that I did, this was one of the most common questions I would get. And the question was, often are most couples having sex, right? And I could tell people were really curious about this. And I started to realize it was because they were comparing their own frequency to whatever I would tell them was sort of the average, or that they at least wanted to
Hmm.
make that comparison to see how are we doing,
Well,
in
don't people want to know
comparison.
if they're normal, like quote unquote
Exactly.
normal?
Exactly. And it's interesting. I mean, that's something that comes up with sexuality a lot because it is, usually more of a private expression. We don't always know exactly what's happening in other people's relationships. And I could tell that there was a lot of curiosity around that. And the research did suggest at the time that there was a positive link between sexual frequency and relationship satisfaction. So people who had more sex tended to be happier in their relationships. But we wanted to sort of give this a closer look. And what we ended up finding was that there was this positive association, but it actually leveled off at a frequency of about once a week. So, what this meant was that people who engaged in more frequent sex tended to report more relationship satisfaction, but you didn't see further gains once people were having sex more frequently than once a week. And again, this is on average. But this was part of the study was a large scale nationally representative survey from the United States with about 30,000 people. So we're sampling a wide range of people here. And then what was also interesting was another factor that's been linked with well being is income, right? How much money people or households make. And we were able to compare the effect of sex frequency on well being to the effect of income on well being. And what we found was that for couples who were having sex once a week compared to once a month, that sort of gain in well being was equivalent to making an extra $50,000 a year. So comparing people who were making 25,000 to 75,000. So just to,
Who got
if
that
that's one
idea
way
to
to
compare it
quantify
with
it.
income? I love that to make that comparison to income. That's
Yeah. I mean, one of the
fifty
things,
thousand
right?
dollars.
Yeah. And one of the things that's interesting, right, is people might not always think about their sex life in that way for their well-being, right? You might think about like investing in your work and your job as being important for your overall well-being. And sometimes in a long-term relationship, your sex life doesn't always take priority. So it was definitely a stat that got some attention when it came
Yeah,
out.
no kidding. I can see couples say, "Oh, we made another 50,000 this week." Okay.
Yeah, yeah, exactly.
Well, and Amy, I'm interested. I mean, once word got out, I don't know what kind of feedback you got from that statistics, but you know, were couples, when they heard the once a week to maintain some kind of, I guess, satisfaction in your relationship, would they find that reassuring or would they find
Me-
that daunting? I don't know.
Many found it reassuring because I think what the message was out there before that was, engaging in sex as much as possible is what's better. There'd been a couple of popular media books in the recent years before that study was published. And one was about like a woman, and I think it was for her husband's 40th birthday. She gifted him sex every day for a year. So 365 days of sex. So there was a couple of similar, just popular stories out there about this. And I think if you read these books or read these stories, there's a lot of nuance in terms of like the pros and cons of that and the consequences for the relationship. But there were some of these messages out there like more is better. And so I think maybe for people who'd heard those messages, this idea, it's like, okay, once a week, like that seems reasonable. That seems like something that we could actually do. And again, I don't know that it's necessarily always just about sex. I think it's also more about just carving out that time for intimate connection, whatever that might look like for the couple. So, I think people thought, okay, we could carve out time once a week. That seems more reasonable. So the most common response that I got, especially among people in long-term relationships, was like a little bit of relief, a little bit of relief, a little bit of reassurance. I mean, certainly there's always people who, for them that would not be enough or that would be too much. Like there's individual differences in these things,
Right,
but
right.
this was sort of an average finding.
And what about, I don't know if you looked at different kinds of couples, but would that be true for other, gay couples, or was it predominantly heterosexual couples you looked at?
In our initial study, it was predominantly people who identified as heterosexual. We didn't see differences by age. We didn't have great representation from much older adults, but from the sample that we had, we didn't see differences by age, and we didn't see differences by gender either. So this was important for both men and women. I do have a colleague who has looked at the same type of associations among people who identify as gay, lesbian, or in same-sex relationships, and basically found a very similar pattern. So it does seem like, at least what we've been able to do so far, that this average finding sort of generalizes across a lot of people.
I'm wondering whether another common question you might get is, for couples, let's say, who've been in a relationship for a number of years, how do you keep that spark alive, right? I mean, that passion that you feel at the beginning of a relationship, right? You want to keep that. I mean, in some ways, perhaps, I guess, over time, long time, it's not practical, but maybe it is possible to some extent to keep that sort of passion and desire alive.
Yeah, I mean, Mary, this is really sort of the question that much of my research has really been focused on understanding, because as you're pointing out, it's a tricky one. We do, the typical trajectory is that you get into a new relationship, it's pretty intense, desire is high, frequency is usually high. And then as we become committed, as we start to get to know each other really well and become more familiar, we might feel really safe and secure. But then that also can dampen some of that excitement and passion and sexual desire. So we do see that on average, couples decline in their sexual desire over time. But it also, as you mentioned, does seem possible. Some couples are maintaining fairly high levels of desire over the course of, multiple decade relationships. And couples are also managing differences in their desire. It's very common for one partner to have higher sexual desire, to want to engage in sex more frequently than the other partner. But there's also, couples that are managing this, and they have these differences, but they're maintaining satisfaction despite these differences.
Mm-hmm.
And so,
and can I just stop you there for a sec?
Yeah.
Because I just want to ask you, one of the common beliefs is that it's usually men who want sex more than women. What does the evidence actually show there?
So we do find that when we look at average levels in our samples of long-term couples, we do find that men will have slightly higher desire on average. When you look at this in a more nuanced way, you do see a lot of variability. So you do see that there's definitely couples where the woman has higher desire, and there's also some fluctuation, right? So when you study this daily, if you track people's desire more at the state level, so instead of thinking about their overall desire, you think about how this varies, you'll see a lot of variability, right? So some days one partner might be higher. So there's definitely couples out there with more chronic differences where it's like, clearly there's one high desire partner and there's one lower desire partner. But there's a lot of couples for whom this might fluctuate over the years and months. So there's some support for this idea that men tend to be higher, but there's a lot of nuance and a lot of variability there.
Mm-hmm. Okay. And then going back to keeping that passion alive, I mean, what have you found there? What do we know works?
So I would say that my research anyway is kind of centered around these two factors. One would be this responsiveness idea. And I think of this as kind of feeling safe, feeling connected, this ability to be vulnerable. And then the other factor would be more related to novelty. And so specifically something that we refer to as self-expansion. So self-expansion was this idea developed by Art Aaron several decades ago. And he found that this self-expansion, which is having novel experiences, broadening your perspective through being with your partner, having sort of this excitement and newness in the relationship, was something that helped couples maintain their satisfaction as they went into long-term relationships. And we studied this particularly around sexual desire. So what we did in an initial study was we tracked long-term couples every day over 21 days. Each day we asked them about their level of self-expansion. So again, this is like how many novel experiences they're deriving from their partner, if they're sort of broadening their sense of self or the world through being with their partner, kind of levels of excitement and newness, those kinds of things. And on days when people reported more self-expansion, they tended to feel more desire for their partner. And they were also more likely to engage in sex on those days. And when they did engage in sex, they found it to be more satisfying. And all of this contributed to their overall feelings of satisfaction in the relationship.
Okay. And when you say self-expansion on those days, what exactly are we talking about?
So we asked them whenever they'd report a certain level of self expansion, we would say, was there a specific activity or something you did that led to those feelings? Can you tell us about it? And one of the really interesting things about asking people that was that we got such a range of responses. And I think when you hear, novelty, you think, okay, we're going to have to like go skydiving, or we're going to have like a European adventure or something. And it really wasn't that. I mean, we were studying these things in daily life. So it was learning new things together. Sometimes couples would mention like, my partner taught me how to make a cherry pie, or taught me, we made dinner together and they taught me how to make a new dish. Some people, it was like exploring a new neighborhood within their city, exploring a new restaurant. I mean, sometimes you didn't even have to like leave your house to self expand. Partners talked about even having interesting or in-depth conversations, maybe watching a documentary or hearing something, that's going on in the world, like a socio-political issue, and discussing that. But that would involve like getting a new insight, right? Your partner would maybe share something, or you would share something that just gave you this kind of new perspective into yourself or them. So we saw a wide range of responses, and it didn't have to be something that was really physiologically arousing or active, although couples did mention things like that as well. And so it seemed like it was really about couples, like the partners in a couple deciding, what might be sort of new and exciting for them.
Yeah. Okay. So the sense I'm getting too, I mean, because you haven't mentioned anything about the bedroom, whereas perhaps some people might assume when you say something new and novel, oh, well, is she referring to actually new and novel in the bedroom?
And some people did mention something sexual. So we wanted to ask about this broadly, like what are they doing in daily life that's leading to self expansion? So we kept it very open. But some people, as their example, talked about a sexual experience that was particularly novel. And actually, in this case, we almost wanted to rule out that it was just about novel sexual experiences, because we were looking at desire, right? So we did wonder, like, well, if it's leading to desire, is this too wrapped up like in something novel sexually? So we reran our analysis, taking out the days when people said their self expansion was about sex, and we still saw the exact same thing. So what this suggests to me is that sex can definitely be self expanding and will probably also lead to benefits in the relationship, but it's not what's driving those effects. These are things that couples are doing outside of the bedroom as well that they're finding sort of new and exciting. And then this is leading to their desire to connect sexually with their partner.
Yeah, there are so many aspects of that that really are interesting because, earlier you were saying that your work tends to focus on these two areas of relationships, where one area is about people's ability to feel comfort with each other, I guess a sense of safety, and then this other area of novelty and excitement. And the two seem opposing in some ways, right? Because how can you have novel with comfort, and a relationship that is stable over long term? Because naturally, I guess there is a certain kind of novelty that's not part of that, right? Because you know each other. Yeah. And yet I find with this self-expansion, you're kind of getting both at the same time, aren't you?
That's right. That's sort of how I've been thinking about it. And you're picking up on, I think, what is this one of the reasons why I wanted to study this in relationships, because I think this is such an interesting paradox, right? Often for most of us in the beginning stages, part of what we're drawn to in a partner is fueled by this desire and passion, these kinds of feelings that alert us to like, this is a person that I have this strong desire to connect with, right? And, that can drive us into the relationship in the early stages. But then, once we, but I think in those early stages, there's a lot of uncertainty sometimes, right? And anxiety. You don't know fully if the person is going to reciprocate your feelings or be there for you, right? So part of what might fuel that is some of the uncertainty and the unknown. And then once we get into a relationship and we become committed, maybe we move in together, we share household responsibilities, maybe, have children together, all these things, often we can feel, much more safe with a person. Now we feel more confident that they can meet our needs. They've demonstrated that to us. We can feel more committed to maintaining the relationship over time. But ironically, that can also squash desire, right? When there's no uncertainty, when partners can become more sort of enmeshed with each other and they just get into the sort of mundane aspects of daily life, of managing a household, of caring for children, of all these things that more domestic responsibilities and managing like the stressors of all of that, they can, things can become less exciting. And then I think desire can fade as a result. So what I've really been interested in is how we can, the responsiveness, the comfort, the safety, that's important, right? Because without that, there can be a lot of anxiety about whether you can trust this person, right? To be there for you, to meet your needs, right? That's, what a lot of us want. We want that responsive partner, right? Who we can get emotional support from, who can be there for us. So that part of a relationship is not bad, right? We want those things to maintain a positive relationship over time. And so I think what this self expansion idea is talking about is within that, maintaining that safety and that sort of, connection, reliability of a partner, also finding ways to kind of inject novelty, right? So to still think about new things that you can learn about each other, new things you can learn together, new things that you can just continue to bring into the relationship that, you can sort of grow together over time. So I think it's not necessarily easy, but it seems like there are ways where within that comfort, you can still have some novelty, even though those things can be a little bit counterintuitive.
Is there any area or I guess any particular research questions that you can hardly wait to investigate, whether it's now or on the horizon,
Yeah.
maybe?
Well, I mean, this, what we're talking about is really something that, one of the things that I haven't been able to fully look at yet is almost this balance, right? Like I've studied where I know that like being responsive and we talked about responsiveness more generally with the COVID study, but it's important in the sexual domain as well. So to feel like both partners are motivated to understand each other sexually and meet each other's sexual needs. That's something that I've found is also associated with desire and satisfaction and navigating these potential sexual differences that are fairly common among partners. So, I've looked at that. And then separately, we've sort of looked at the role of self expansion in desire. And I'd really like to kind of combine those things because I think that there's something going on where we want, in one study, we thought about it as like the closeness and the otherness. So, this idea that like we want to have this closeness and connection with our partner, but we also want to have this otherness, which is like this room to have unique new things be brought into the relationship. Like, still have opportunities to like be surprised and be intrigued. And I'm interested in thinking about the balance between these things, right? How people balance that in their relationships. And I'm sure that there's individual differences, right? For some people, for many reasons, the closeness aspect might be particularly important for them to feel safe and be able to be vulnerable. For other people, they might really need to see that there's opportunities in the future to continue to be surprised and challenged and intrigued. And so I'm very interested in how people balance those competing needs and, maybe, what different people might think about that or how that's ultimately associated with relationship maintenance.
Yeah. Um, you were talking earlier about being at social events and people asking you, certain questions. And I have to wonder whether are you the most popular person at a party?
Well, I mean, Mary, I haven't been to a party in a while. So.
Before the pandemic, you had to be. Were you not? People probably were searching you out once they found what you did.
Yeah, it was very interesting, and people would share. And I mean, now, right, the questions that you started out asking are more of the questions that I'm getting now, right? Is about COVID, right? And what's this been like? And people are seeing the changes in their own lives and relationships. And they knew that I was doing some work on COVID and how this was impacting relationships, and couples were curious about that. And I think for the same reason, right? Like, what is happening? Is my experience similar to what other people are going through? So definitely, I think people have a lot of, they have a lot of questions about relationships is such an important part of everybody's lives. And then, like I said before, sexuality in particular is this kind of private domain. And there does seem to be a lot of curiosity about, what's happening in the relationship and sex lives of these other people in my life. And is this similar to or different than my own experiences? So I certainly still get asked those kinds of questions when I have been able to go to social events.
Absolutely. Well, I hope we can continue this discussion. I thoroughly enjoyed it, Amy, and you make it all so accessible.
Oh, well, thank you so much. It's been such a pleasure talking to you. You're just a delight, and this has been so much fun.
Thank you, Amy. That's Amy Muise. She is an associate professor in the Department of Psychology at York University. And if you'd like to know more about the fascinating research that Amy is doing, take a look at our show notes for more info on her. Hope you enjoyed the show today. Thanks for joining us.